Good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer here at OU Health and the university's Chief COVID Officer. I'm going to give a brief update on where we're at with cases in Oklahoma right now, and then highlight some of the things that I've been watching in the literature over the past week, and we'll be happy to answer questions. So the first thing, cases obviously have dropped dramatically in Oklahoma. I think everybody's aware of that. As of this morning, Oklahoma is recording about 75 cases per 100,000 population per day, which is substantially reduced because we were over 300 just a few weeks ago. I will highlight, however, that at the peak of the Delta surge, we were only at 66 new cases per 100,000 population per day. So we haven't even gotten down to the peak that we had with Delta this past summer. So we're still pretty high. We're 29th in the nation in terms of new cases per day and new cases per week per the CDC. Part of that is that every state in the country is seeing their rates of COVID-19 drop at this point. So that's all good news. So if you look at today's graphic, we hit a milestone. We've had more than 1 million cases now of COVID-19 in Oklahoma. We had a lot of deaths reported today. We're up to 13,758. So just within the past week, we've had 16,543 new cases confirmed, and 346 more Oklahomans have lost their life to COVID-19. So the death toll is really substantial. It remains at 1.4% of all of those people who test positive in our state. I created a new graphic that just showed the new daily cases, and I highlighted that on January 15th and 16th, we had more than 14,000 cases a day. And I think most of you are aware that over the past 3 days, the case count has been down substantially, down to 796 on the 7th, just under 1,000 yesterday, and 1,700 today. I did put on the graphic, however, that we had a bad winter storm last week, and cases that are reported always lag behind testing. And I'm still concerned that some of the drop in the cases that we've seen reflect lack of testing that occurred during the winter storm. In fact, we were consistently seeing almost 4,000 cases a day before the winter storm. So I do think cases have come down dramatically. That the case count is much, much lower than it was a couple of weeks ago. I'm just not sure that the numbers over the past 2 or 3 days adequately reflect what's actually happening in the community. So if you look at the 3-day rolling average and the 7-day rolling average, remember when we first started the pandemic, we were told to look at the 14-day trend. Both of those are like Olympic ski slopes, coming down very dramatically in terms of new cases per day. The other piece of good news is that hospitalizations have also come down. So today we're just under 1,700 people in the hospital in Oklahoma. Remember, we got up over 2,000 people in the hospital, so that's good news. About 21% of those patients remain in the intensive care unit. So very sadly, we're going to continue to see deaths that occur because of COVID-19, but hospitalizations have come down. I know in our own system, we've seen hospitalizations come down, and we've also seen the number of staff that are being isolated or quarantined has come down substantially. So again, that tells me that we're seeing reduced levels of cases in the community. And then finally, just in the terms of the case update, the CDC map on community transmission remains red for most of Oklahoma except Harmon County. So we should all be in Harmon County, where they have very, very low rates right now of transmission of COVID-19. So just some other news. I pulled up the Johns Hopkins dashboard this morning just to see where we're at in the United States. And I think most people know that we've seen continued growth in the number of deaths. About 2,600 people a day in the United States still die from COVID-19. In the world, more than 401 million cases of COVID-19 in the world, 5.7 million deaths. Very important to recognize the world has given more than 10 billion doses of COVID vaccines. The United States, we're at 77 million cases of COVID-19, and we did go over 900,000 deaths this past week. And of note, in the United States, we've given 541 million doses of the COVID vaccines, which once again highlights how safe these vaccines are, because we're not seeing wholesale complications from the vaccines. They're incredibly safe. Well, so let's talk about the vaccines for just a moment. I've been on a bit of I'll call it my soapbox about vaccines. And I want to highlight that despite the fact that we're still using today the same vaccines, exactly the same, nothing has changed, that were given emergency use authorization in December of 2020, those same vaccines remain incredibly effective at preventing the severe complications of COVID-19. There have now been 7 studies published, 4 in the United States, published by the CDC within the past week or so, that show that if you've been fully vaccinated and you've received a booster dose, your chance of getting sick enough to be hospitalized or to have severe complication like death is incredibly low. And so I wanted to highlight 3 of those studies just because they're so profound, and when you look at the graphics, it becomes really clear how important being vaccinated and boosted is to prevent complications of this disease. So the first study occurred in 10 states, and they had 383 emergency rooms and urgent care centers, and they also looked at patients that were hospitalized, 87,000 people who were hospitalized with COVID-19. What they found was people who had received the vaccine and the booster dose, the vaccines remain very effective at keeping you out of the emergency room or urgent care. In fact, during Delta variant surge, 94% effective. During Omicron variant surge, 82% effective. What you're going to see in this data is we know, all of you know, people who were fully vaccinated, boosted, who got COVID-19. There were breakthrough cases for sure. They just didn't get nearly as sick. So 82% effective at keeping you out of the ER or an urgent care center. But even more importantly, when you looked at hospitalizations, people who were fully vaccinated and had received their booster dose, 94% effective at preventing hospitalization during Delta, and 90% effective at preventing hospitalization with the Omicron variant. So the vaccines are doing what they're supposed to do, which is keeping you from getting really sick. Well, we can go on, and a much larger study that was highly noted, 25 jurisdictions in the United States, 6.8 million cases of COVID-19 among unvaccinated people, 2.8 million cases of COVID-19 among fully vaccinated people. When you look at the graphic that'll come out in the handout, I'll highlight that in the left side, again, when you look at cases, it's really easy to see that yes, fully vaccinated people did get infected with COVID-19, with the Delta variant in this particular study, but the risk of death was incredibly small. The risk of death was 0.1 per 100,000 people if you were fully vaccinated and had had your booster. It was 9.7 if you were unvaccinated. That's a 97-fold reduction in the risk of death. So you probably heard the headlines that people who are unvaccinated against COVID-19 were 97 times more likely to die from the disease than those who were fully vaccinated and boosted. Again, these are all people who actually got COVID-19. And again, I put the graphic in because it is so incredibly obvious when you look at the data how protective being vaccinated was to keep you from having a severe complication of death from COVID-19. And then finally, I put one more graphic in, and it was a large study from Los Angeles County, published by Cedars-Sinai, 423,000 people in the study, and again, it showed that if you were fully vaccinated and had your booster, your chance of being hospitalized with the Omicron variant was very, very low. So again, even though we're using the same vaccines, they're not variant specific, they haven't been changed, they're both, and when you look at Pfizer and Moderna, they're both fully FDA approved, They're working very effective. They're doing exactly what we want. Doesn't guarantee you won't get COVID. Just like a flu shot doesn't guarantee you won't get the flu. It keeps you out of the hospital. It keeps you from having severe complications. Now, I'll acknowledge that there are some people in the population who are highly immunosuppressed, and they may not develop a good antibody response. And so those people, we need to do other things to protect them. I want to finish up by talking about something that I think all of us in Oklahoma need to be aware of, and that's what are going to be the long-term consequences of COVID-19. You know, we've had a lot of cases, more than 1 million cases now. We've had 13,000 plus deaths in our state. But we also know that there's going to be a substantial number of people who develop long-haul syndrome or complications that last much, much longer. And there have been a variety of studies this past week and other studies that have come out that I think are important for us to remember. So the first one is MIS-C, the multi-system inflammatory syndrome in children that has been reported. There was a very nice study that was published out of Colorado that looked at who were the patients most likely to get MIS-C. So now we're talking about pediatrics. What kids are going to get this particular complication? And what they found was male children were about 59% more likely to get MIS-C. Children who are black or African American race, 44% more likely. Kids that were younger than 12. This particularly impacts young kids. Less than 12, 81% greater risk of MIS-C and obesity. We've known for quite a while now that obesity is a risk factor for the complications of COVID-19, and it was those kids were 76% more likely to get MIS-C. So it's an important article that starts helping us predict who may be at risk of the complications, but it also, again, highlights that kids in these categories need to be vaccinated so that they don't develop this very severe complication that occurs in some kids. One of the big unknowns at this moment is, will the incidence of long haul be as great with the Omicron variant as it was with the original virus or the Delta variant? Will it be? And honestly, there are not enough studies at this point to even know that, because we're just getting through the Omicron surge. But that's one of the big questions. Will we see, since so many people got infected, are we going to see a whole lot more people now develop long-haul symptoms? We know certain symptoms didn't occur as commonly with Omicron, like loss of taste and smell, but there are other complications that may occur. So in one of our previous press briefings, I had highlighted a study that was published in January looking at children who had COVID-19, and in that study I highlighted that there was an increased risk of diabetes being diagnosed in kids who recovered from COVID. I will also point out that in the past week there was another study that was reported that showed that adults have some of that same risk, that the likelihood of a diagnosis of type 1 or type 2 diabetes is increased in adults who recover from COVID-19. I think it's very, very important that people understand that, because again, just because we got through an acute phase of infection, we're going to continue to see consequences of COVID-19 probably for years to come. And I highlighted a couple of studies that looked at diabetes. But the one that really caught my attention this morning was done in veterans in the United States, a VA study, and they looked at the long-term cardiac complications of COVID-19. And what they found was that veterans who had COVID, who recovered, were at increased risk of cardiovascular disease, including stroke, cardiac arrhythmias, ischemic and non-ischemic heart disease, in other words, heart attacks, pericarditis, myocarditis, heart failure, and blood clots, thromboembolic disease. And this risk lasted for at least a year after these people recovered from COVID-19. And in this study of veterans, they found that it was a true, even in people who were never hospitalized with COVID, but recovered in the outpatient setting. So again, I think it just highlights for me that you really don't want to get COVID if you can avoid it, or you want to have fewer complications. And it highlights the very, very much importance of getting vaccines. So last thing I'm going to say is many of you have received in the mail your home COVID test kit. One point I would like to make is that if you look at the manufacturer recommendations, these shouldn't be frozen below a certain temperature. And if you received yours during that cold weather snap and they set in your mailbox for any period of time and the reagent, the liquid inside, was frozen, if you get a negative test, just take it with a bit of a grain of salt. You may need to either repeat the test or seek out a regular COVID test at a testing center, particularly if you have symptoms. So just be aware of it. We know a lot of people got tests. They're being done. Some people are testing positive. That doesn't show up in our case counts at this point. So I'll stop there.
And I did have specific questions about that. With those home test kits now, how do we account for the positive case counts? And are you still multiplying by what the state reports by 3, or are you using another method?
Yeah, so the question is, how do we account for all the home tests that we know are being done? And I would point out the other group is people who develop symptoms at home. Maybe they're relatively mild, they just don't ever get any tests done. So we know those people exist out there. I'm still multiplying the state's number by 3. It may be higher than that. Just recognize that there are definitely more cases in the community than go get reported by the health department because they didn't go and get a PCR test done.
Okay, and you talked about the snow, and a lot of the testing sites were closed last week. So, and you really kind of went into this, but maybe just state it again. That he's asking. I imagine this has thrown off the 7-day average and other metrics.
Yeah, so that's why I created that new graphic that showed the daily count of COVID. Again, if you look at the several days before the winter storm, we were seeing about 4,000 cases a day in Oklahoma. And then after the storm, that number dropped below 1,000. Today it went back up to 1,700. So I think over the next few days, we're going to know what the real count is in Oklahoma of people who are testing positive via PCR. I do feel comfortable, though, that cases in Oklahoma have come down considerably. And I feel comfortable because hospitalizations are coming down, and the number of people that we as a large employer are actually having to put in isolation or quarantine has also come down significantly.
Ask you this question without getting political. What sort of priority do you place on mitigating COVID for the future of Oklahoma?
So the question is, what would be my priority on mitigating COVID for the future? So I've been actually having that conversation with some of my colleagues here. I think it's a little bit early to get too lax in what we're doing. I still think kids should be wearing masks in school. I think generally people should be wearing masks when they're in indoor settings to reduce their risk of getting COVID-19. But I have to say that the 7 studies now that show the profound impact of being fully vaccinated and receiving a booster make me feel much, much more comfortable in the community that I believe it is our way out of the pandemic. To get as many people as possible vaccinated, to make sure they get their booster doses, because not only does it reduce cases, not to say it takes it to 0, because some people do get infected, but they don't end up in the hospital, they don't die from the disease. It's not 100%. There are some people who the vaccines won't help because of their underlying medical conditions. But I still think it is by far the most important thing we can do to mitigate the spread of COVID-19. And I truly believe that if we can get our vaccination rate up and make sure people get their boosters, we can really go back to what we would much consider near normal type of activities.
That's it.
All right.